Okay, my name is Andy Smith. I'm from a city called Witbank, which is in South Africa. The problem that I had was severe pain and immobility in my left hip, which I had for about 2 years. And due to various reasons, one of them being the costs, I was unable to get the surgery done in South Africa. I can honestly say that my experience above my expectations. I was met at the airport, despite my flight being like 2 hours late. I was brought straight to the hospital. I did my admission, I was taken to the ward. The nurses there made me feel very welcome. They got me settled in my bed, and from there they started doing their pre-operation tests and x-rays and CT scans, which was more than what it was originally anticipated because of the extent of the damage to my hip.
Today we will be talking about a 64-year-old pleasant gentleman, Mr. Andrew Smith, who traveled all the way to Mumbai from South Africa to have his hip replacement done. He traveled all the way to have it done through minimally invasive approaches and with the use of robotic technology, something that we specialize in. When he presented to us, he had an extremely bad hip with severe degrees of osteoarthritis. So as we can see on the x-ray, this is an x-ray of the left hip, and as we're trying to identify the socket, which should be somewhere here, we cannot clearly see where the socket is. And we can see that this ball is not round at all. In fact, the ball is flattened out here and almost dug into the socket. So this is actually a very advanced stage of secondary osteoarthritis.
Now we are looking at 10-11 days after my surgery. I'm able to walk around without a crutch, even though I use one just in case I lose my balance. Have virtually no pain. And very, very, very happy with the outcome of the procedure. He did a very good job.
The surgery went absolutely as per plan. It was completely uneventful. We achieved precise positioning of both the femoral as well as the acetabular components. Physiotherapy was started the same evening, and he was up and about walking on the same day of surgery.
The nursing staff were very good, very competent, very caring, very compassionate. Dr. Mudit himself, in my opinion, is probably the top guy that I have seen, orthopedic that I have seen with this problem, to the extent that had I had a conventional surgery in my country, it probably wouldn't have worked.